What you need to know about smoking and your brain. Tobacco use is the leading cause of preventable death in the United States. According to the Centers for Disease Control and Prevention, CDC trusted source, close to 500,000 Americans die prematurely each year due to smoking or exposure to secondhand smoke. In addition to increasing your risk for heart disease, stroke, cancer, lung disease, and many other health conditions, smoking also has a negative impact on your brain. In this video, we'll take a closer look at the effects of smoking on your brain, as well as the benefits of quitting. What does nicotine do to your brain? Most people understand how smoking affects the lungs and heart, but what's less known is the impact that nicotine has on the brain. Nicotine mimics several neurotransmitters, which send signals in the brain. Since nicotine is similar in shape to the neurotransmitter acetylcholine, signaling increases in the brain. Nicotine also activates dopamine signals, creating a pleasurable sensation. Over time, the brain begins to compensate for the increased signaling activity by reducing the number of acetylcholine receptors. This causes a nicotine tolerance, so continued and more nicotine is needed. Nicotine also stimulates the pleasure centers of the brain, mimicking dopamine, so your brain starts to associate nicotine use with feeling good. According to the National Institutes of Health, the nicotine in cigarettes changes your brain, which leads to withdrawal symptoms when you try to quit. When this happens, you may experience a variety of side effects including anxiety, irritability, and a strong craving for nicotine. Unfortunately, when these symptoms strike, many people reach for another cigarette to ease the effects of withdrawal. The changes that occur in the brain as a result of this cycle creates a dependence on nicotine because your body is used to having the nicotine in your system, which then becomes an addiction that can be difficult to break. While the effects of nicotine may take a while to notice, adverse side effects related to the heart and lungs are likely the first ones a smoker will notice. Here are the most common side effects of nicotine and smoking on the brain.